would like to welcome everyone to our session about wash responses to COVID-19. Let me just quickly talk you through the agenda, but before that, let me remind you that this session is being recorded. So if you keep staying in the session, it means that we have your permission to record you, and the recording will be made available later on as well. Also, please stay muted if you are not talking. If you have questions, please post them into the chat box and we will try to ensure that we will take all of your questions. And also you get to ask questions through the chat box in the moderated discussion that is planned for later today. Also, after the session, you should definitely stay tuned for the next one that will be about the importance of WASH for neglected tropical diseases. But first and foremost, I will just briefly introduce you to the speakers. Then we will have some welcome remarks by Arne Parnazar. We will move on to the inputs from Robert Draghi, Nora Chansa Idonje, then Jumana Al-Ayed, followed by a moderated discussion, and then a wrap-up and some nice closing words. So without further ado, the stars of our show today are Arne Parnazar. He is the program director of the GIZ Sustainable Sanitation Program. He studied biology and did his doctorate in India on water mites. He has been heading the sector program since 2014. Arne is a passionate guitar player and has also worked as a taxi driver during his student days. Welcome, Arne. And next up, we have Nora Chansa Idonije. She has participated in policy and strategy developmental processes in WASH since 12 years. She has been with GIZ in various portfolios since 9 years, and she is senior policy advisor for the reform of the water sector program in Zambia. A little fun fact about Nora: if you tell her that you keep cats, she will never come to visit you. Moving on to our guest, Robert Drybelvis. He is an associate professor at the London School for Hygiene and Tropical Medicine at the Hygiene Hub. He is member of the Environmental Health Group, which is a research group specializing in the public health aspects of water, sanitation, and hygiene in low and middle income countries. Robert, during lockdown, has taught himself how to make chocolate soufflés. Very well done. And last but not least, we have Jumana Al-Ayed, who is the country coordinator for GIZ Sanitation for Millions in Jordan. She's an agriculture engineer committed to water communication, and she's been in the water sector since 17 years. She has also several years of experience in asking for directions because she has a terrible sense of orientation. I'm Alice Brandt, your moderator today, along with Ann-Kathrin Temple, who will be moderating the session today with me. So without further ado, thank you so much for joining. And now on to Arne. The floor is yours.
Thank you, Alice. I'm very happy that we can meet here virtually. It's not possible in Stockholm, but I think like this we can continue the exchange. The high number and diversity of participants as well shows us advantages of the virtual format. They enable access of many people who can't easily travel and reduce our carbon footprint. We already saw that in the series of online sessions of the Sustainable Sanitation Alliance last week, which is continued this week through joint sessions with this Water Week for Development. That's great. Before we listen to the insights of Robert on the global responses to COVID-19 and to two country examples from Zambia, I'll take the opportunity to make one key point from my side and talk a bit about the German Ministry of Economic Cooperation and Development, the BMZ. My key point is that hand washing and PPE, personal protective equipment, are key additional measures, but they can only be contributing to change if we continue to address as well the broader picture. For example, when in India the National Institute for Urban Affairs was discussing immediate steps with the cities, they found out that they do not know how many sanitation workers they really have, as many work in the informal sector. So then how can we provide PPE to all those who need them? How can we plan who is doing frontline work and who's waiting in the second line to be ready if a frontline worker gets ill? The answer is that we must continue and intensify the good work we are doing in the broader WASH sector. We need to develop responsible institutions, support utilities, build capacity on the broader topic, promote inclusive regulations, and thereby leave no one behind, especially include sanitation workers, pit emptiers, and those involved in fecal sludge management and managing treatment plants or other system elements. And I think we'll be doing exactly this as well in German development cooperation work. In the recent months, we can see two ways of response from the German ministry. First one is the large financial COVID-19 response package. In a very short time, BMZ has restructured its own budget lines. €1 billion will be spent by the end of this year in order to support COVID-19 responses in a broad sense, including to maintain food production, social security, stabilize the liquidity of states. WASH is part of this package, maybe not as prominent as some of us would like it to be, but a range of programs such as this one in Zambia have received support, for example, to implement hand washing facilities, support the utility to maintain basic services, and for hygiene and behavior change measures. The second way of response is a more strategic change of BMZ's way of approaching global health. COVID-19 has been a wake-up call that made clear that challenges cannot be tackled in one sector alone. BMZ has therefore taken COVID-19 as an opportunity to break new ground in development cooperation. The holistic and intersectoral One Health approach is the new guiding principle for BMZ's action and programming. The fundamental idea of One Health is that we need healthy people, we need healthy animals, and we'll only get those if we have a healthy environment, healthy ecosystems. So we have to look in the broader picture and work on all these sectors in a composed way. Preventive measures within, but above all outside the healthcare system, can reduce the probability of transmission of infectious diseases and at the same time contribute to a range of sustainable development goals. A broad approach towards safe water, adequate sanitation and hygiene is one central preventive measure in this concept. The paradigm shift comes also along with structural changes within BMZ. A new directorate, Global Health, Pandemic Prevention and One Health, has started on 1st of August in the new division on water, sanitation and hygiene. And this new division is part of this new directorate. A One Health strategy is currently being finalized. Altogether, I think these are very positive signals that we are receiving from the political side. The fundamental role that functioning WASH systems in the broader sense, I've described them, play for human health and a healthy environment is more and more acknowledged. And I'm now very excited to listen to how WASH has been practically implemented in different countries and globally in order to slow down the transmission of COVID-19. Thank you, and back to you, Alicia.
Back to me. Thank you, Arne.
Yes, great.
Thank you, Arne, for setting the scene and these really interesting insights on the German or the BMZ response to COVID-19. We will directly move on to our next speaker, Robert, who will continue with a rather global perspective on the pandemic and the response of the WASH sector. And maybe just one quick remark to all participants, please turn off your cameras if you're not speaking. Thank you, Robert. The floor is yours. Robert, your mic is still off.
Sorry.
Yes. Thank you.
How we're all working these days. Thank you very much, and thank you for the invitation to present today. As discussed, I'm Robert Tribelbus. I'm with the London School of Hygiene and Tropical Medicine, and also the executive director or kind of research director for the COVID-19 Hygiene Hub. Next slide, please. So for those of you who don't know, a brief overview, the COVID-19 Hygiene Hub, it's housed within the London School of Hygiene and Tropical Medicine, but we're a broad partnership of over 10 different organizations, primarily research organizations, that's really designed to kind of support and shape evidence-based hygiene interventions to combat coronavirus. Now, through this role, since April 2020, we've provided technical support in various capacities to over 180 partner organizations. We've mapped and analyzed or gotten collected information on over 200 different COVID-19 response programs. And we've developed a series of online resources that have been viewed over 25,000 times so far. The rest of this presentation will really be based on our interactions with partner organizations, understanding some of the main kind of strategies that have been used, success stories, and challenges in the global response to COVID-19. Next slide, please. So, as discussed, we know that improved hygiene, and when I say hygiene, I'm taking a rather expansive view here and referring to this as hand washing with soap, surface hygiene, just keeping things clean within the environment. We know they're key public health interventions to curb the transmission of COVID-19. But we also know that hygiene is something that we have a long tradition of in public health research. It's been part of many health campaigns. Most WASH campaigns have a hygiene component, and we as organizations implementing may have materials and communication strategies already that we were implementing pre-COVID-19. But what this really means and the implications of this for COVID-19 response is that when it comes to hygiene, we're dealing with something that has high exposure in the general population. We really do need to adapt messages, targets, and our delivery strategy, and we'll talk about why some of these. But we've also benefit from the fact that we have a large body of knowledge to help inform some of our strategies. We're not shooting in the dark here. These are not new behaviors we're trying to promote and to kind of get people to adopt. Next slide, please. So, based on kind of what we know prior to COVID-19, this was from a systematic review of interventions to change hygiene behaviors and sanitation behaviors that was completed by DeBrook and colleagues in 2017. And what they did is they mapped out types of interventions and their impact on the uptake, adherence, so behavior over a period of time, and sustainability of behavior change. They classified interventions into 4 different categories: information and education, community-based approaches, social and commercial marketing, and then finally psychological and social theory-driven interventions. And I think this is really powerful because one thing we often say, kind of as my focus is on behavior change and hygiene behaviors, and we often say that education is not going to really kind of result in lasting change. And this is one of the first reviews to really show that in the long term, simply educating people and informing people doesn't necessarily lead to long-term behavior change. And this is one challenge that we're often facing within the context of the pandemic, that our immediate response strategies, often when it comes to getting people to change behaviors, are often to educate on COVID-19, to inform people about COVID-19. But ultimately, when we look at the relationship between knowledge and behaviors, we don't see a lasting effect of that. So if we really want to deal with long-term change, we need to think beyond just education. Next slide, please. An example of this, of how this actually does play out, and we're seeing this in COVID-19 response globally, and we've seen this in previous outbreaks, is early in the pandemic, like I said, we're often focusing on messaging. So we're teaching people about COVID-19, we're informing people of the risk, we're informing people about the things that they should do to keep themselves healthy. And what we often see is an immediate spike in behavioral adoption. I know here in the UK, where I'm based, as the pandemic was starting, it was virtually impossible to purchase hand sanitizer anywhere. There was a mass rush in the stores to buy every type of hand sanitizer available. So there was clearly a massive spike in hand hygiene behaviors or general hygiene behaviors. One click, please. But what we often see is with this continued messaging, people just kind of reach a point of saturation. Messages just come over and over. And what we often find with that is that the sense of risk that's driving that initial adoption tends to fade. People become very used to this. And what you often see is a kind of flatlining or even a regression of key behaviors over time back to kind of pre-outbreak scenarios. So what can we do to really maintain and hopefully harness these improvements in behavior that happen early in intervention? Next slide. Well, one thing to remember is that just because we are in a pandemic, the barriers to hand hygiene or the determinants of hand hygiene are still there. These are the same things that are really driving how people kind of behave, the hygiene behaviors people practice. And what we know is that there's a whole range of things that really influence hygiene behaviors. These have been classified in various reviews. A recent one that was produced was in 2020, looking at the determinants of hand washing behavior in a domestic setting. We know that these apply to a range of hygiene behaviors, not just hand hygiene. But in order to get kind of lasting behavior change, we need to make sure that we're addressing barriers beyond just knowledge. Next slide, please. So when we think about adapting existing WASH programming for COVID-19, I think there's the next we'll go through some kind of key principles that we've viewed from kind of our work with various WASH actors around the globe. The first part is really making sure that we're thinking about key moments and target populations. You see on the right some traditional hygiene programming. These really do focus on kind of the 5 moments for hand hygiene, which we often know. This is after using a latrine, after cleaning a child, or anything related to feeding. We also tend to typically target caretakers of children under the age of 5. So we have materials and messages that typically target oftentimes mothers. So but when we think about COVID-19, there's a whole range of new moments that we need to make sure that we're really addressing. These are after, before entering and leaving a home, after contact with any individual, but we also need to understand that we're dealing with very different populations. The image on the right is a graph of coronavirus deaths by age. So our target populations for improving hygiene are now oftentimes protecting older populations rather than younger populations. And we need strategies that are going to cover everyone in society, not specifically targeting or supporting caregivers of children under the age of 5. Next slide. Sorry, this is a duplicate of that slide. Next slide, please. So when we think about WASH programming for COVID-19, one thing that we need to really think through and be specific for is that no one size is going to fit all. I think it's often tempting when we realize the scope and scale of the COVID-19 pandemic that we want to just kind of implement one strategy that's going to benefit everyone. But what we know is that we really need to sit back and define our target groups and identify the appropriate ways to engage with those target groups. Different target populations, so that could be older adults, that could be disabled populations, that could be children, really will have a different constellation of determinants and factors that are going to influence the extent to which they're able to or willing to practice improved hygiene behaviors. Tailoring messages to the delivery of the population you're really trying to reach is very critical to this. And we need to make sure that we're targeting in the proper setting. We're realizing now kind of how underfunded and how under-resourced the health facility is in terms of hygiene infrastructure, schools, public spaces, everywhere people are. We need to ensure that hygiene is a viable behavior. We're also realizing that our traditional forms of information dissemination or kind of reaching out in community engagement are quite difficult under kind of lockdown conditions. So finding innovative new ways to engage with populations and target them with the key messages and strategies that are going to foster improved hygiene behavior is important. Next slide, please. Another key thing about adapting WASH programs for COVID-19 is that these strategies really do need to evolve over time and into the changing nature of the pandemic. I think we've all seen, most of us around the world have gone through various waves of lockdown, easing of restrictions. In some places, those lockdowns have kind of started up again. We've really seen this pandemic really wax and wane over time in a variety of locations. One thing we can learn from here is the general disaster response cycle, which thinks about things in terms of preparedness, response, recovery, and long-term mitigation. Changing hygiene behaviors or fostering proper hygiene behaviors for COVID-19 response, we really need to think about that as a process, not an event. It's not going to be a one-time intervention. We need to think about how we can change our strategies in response to the changing nature of the pandemic. Next slide. So some other things to kind of keys to adapting WASH programming is that we really need to make sure that we're creating an enabling environment for hygiene. Infrastructure is important. Water and soap are really necessary for hand hygiene or for any type of hygiene behavior. I'm using soap, but likewise, alcohol-based hand sanitizers, some types of cleansing agent. These are all the core components necessary, without which any strategy we implement around hygiene behavior change will be kind of will have no effect. We do know from research that households with dedicated locations for hand washing, where there's both soap and water, are much more likely to wash hands than in households without these dedicated locations. So it's not just having soap and water in the home, it's making sure that they're convenient and accessible. Some strategies that we're seeing and challenges that many organizations are facing is how do we promote hygiene behaviors when water is scarce? And we have seen success stories about coordination with local and municipal authorities. Also interesting strategies around reducing tariffs and implementing alternative fee structures. I think we often think when water is scarce that that's because the resource is not available, but water scarcity can also be an economic factor. So finding ways for particularly low income and vulnerable households to afford access to water is key to ensuring proper hygiene behavior. Within systems and distributions, we've found that kind of other strategies for increasing system and storage capacity to just enable more water to be in systems or provide kind of local reservoirs, kind of tanks for local water availability really do kind of help allow kind of hygiene behaviors in specific contexts. We've also seen, and something kind of that does need some contextual, that is not acceptable everywhere, but the use of gray water for hand hygiene. So things like repurposing water for washing and dishes, or for washing dishes or washing clothes can often be used for hand hygiene as well. But there are kind of cultural limitations to this in certain contexts. But also beyond kind of just kind of increasing water or increasing water access, there's also other more creative ways that I think we can be addressing the fact of water availability in the home. One thing that we've learned from literature, from the studies that we've done, is that oftentimes the perception of water availability is actually more important than actual water scarcity within the household. We can address this through specific messaging strategies. We can provide tips for water saving within the household. We can demonstrate ways to reduce water use during hand washing with soap. We can also think about creative ways to implement water saving infrastructure. There's a number of commercial products that are available that can limit the water use for hand hygiene. Many of these can be locally produced or even kind of do-it-yourself type solutions. So thinking beyond just kind of our traditional hand washing stations and really making sure we're fostering and utilizing innovation. Next slide, please. The other key resource that we need for kind of any type of hand hygiene is soap. And I'm using soap as a catch-all term for any type of cleansing agent, because we do know that any type of soap is effective against SARS-CoV-2. We've seen globally having access to dish soap, having access to laundry soap. These are often much more common than traditional soap that we reserve for hand washing. So understanding and working with households to utilize any soap material can be one way to kind of foster hygiene behaviors. This is often about addressing resource priorities at the household level, so working with households to make sure that they're utilizing and allocating resources appropriately. And we also have seen kind of recent innovations in alternatives to soaps. The image on the right here is soapy water. This is a local solution made by dissolving laundry soap in water that's found to be relatively acceptable and used in specific contexts. So there are creative ways that we can think about kind of increasing access to soap in the household. Next slide, please. Some other things that thinking about, particularly focusing on hygiene behavior, is that we need to really think beyond just messaging. One area that we kind of think is underutilized or that could be utilized more is the use of nudges, cues, or triggers to kind of foster behavior. These can really serve as reminders for to practice hand hygiene at the key moments. So some of these images, this is an intervention in Bangladesh that simply use these kind of visual cues and reminders to kind of trigger hand hygiene after using a latrine. The watchful eyes here were incorporated into an intervention in India about increasing hand hygiene, and found that people were more likely to practice hand hygiene in the presence of these eyes than than individuals who were not. So these are kind of simple ways that we can alter the environment to really trigger and initiate hand hygiene behaviors. Next slide. The other part of this is, as we think about kind of promotion strategies, we're seeing quite a bit on educating around SARS or COVID-19, providing households with information, providing them with information on what they can do to protect themselves. And we are rapidly reaching the point of saturation of those messages. When we think beyond knowledge and education, what we do know around hygiene behaviors is that motivations and emotions can be important drivers of what we do. These have been used successfully in non-pandemic and outbreak settings to really change behaviors. So these are images from various campaigns that have been implemented in the past. The bar of soap in the middle was from the Super Amma campaign in India, which really used the motive, kind of the emotion of wanting to protect children to really increase hand washing with soap. The images on the right are from the Respect People campaign in Nigeria, which really worked to kind of link hand hygiene behaviors with the feeling of this is something we can do to show mutual respect. This is something we're seeing kind of globally about ways that we can encourage people to take appropriate precautions. I recently was watching a YouTube video this morning, and an Uber ad came on about wearing your mask. And we've all heard the thing, my mask protects you, your mask protects me. Same thing with kind of hygiene. We need to move beyond just teaching people and really understanding and utilizing some of the key drivers of behaviors. Next slide, please. Another thing that we can do around COVID-19 is really build on new norms around hand hygiene or hygiene in general and make COVID-19 personal. We've seen kind of ways that this has been done, often very creatively through digital media. One example here was the Safe Hands Challenge, where people were kind of filming themselves washing their hands and posting that to social media. Another part of this is the personal stories. We're often hearing kind of, we see quite a bit of kind of general knowledge around hand hygiene, but without these personal stories, it often becomes very difficult for individuals to understand the nature of this. So we've had the kind of, this is the actor Idris Elba, who recently posted a video describing his own experiences with COVID-19 and how using that to motivate kind of changing and adopting key behaviors. Next slide, please. The other part is really making sure that our strategies are going beyond just the household. I've mentioned before that we need to really make sure that we're covering schools, health centers, prisons, care homes, any environment where there could be potentially vulnerable individuals. There's other parts of this as well where we as a WASH sector really haven't been paying much attention, and we're just now realizing the importance of this. This is locations where people gather. These can be workplaces, these can be markets, these can be transport hubs. We're seeing the need to increase hand hygiene availability at the entrance to buildings, see this all the time at the entry to my local grocery store. There's a large hand sanitizer, but how do we implement this in low resource settings where materials may not be available? We need to make sure hand hygiene is available where food is prepared or eaten. And all of these are going to require new systems for monitoring and support from an organization that we're still working through right now. Don't have any kind of key insights here because this is something that many organizations are struggling with, and we're all trying to kind of figure out what's the best way to provide public access to hygiene materials. Next slide. So with that, I think we'll turn it over to our GIZ colleagues to present more about their specific experiences. But just as a final note here, you know, if at the Hygiene Hub, as I mentioned, we're based at the London School of Hygiene and Tropical Medicine, but we have a large network. You can email us or visit the website and interact with us in various capacities. Thank you.
Thank you very much, Robert, for this excellent presentation and for highlighting to us what we have to consider when adapting our WASH programs. And I'm really happy that we now get a practical example from Zambia, and Nora will tell us how they have adapted their activities and measures to react to COVID-19. And if you have any questions to Robert and the other speakers, please put them in the chat and we will then have time at the end to react to them. So Nora, the floor is yours.
Okay, thank you very much, Anne, and hello participants. This is Nora from the GIZ Zambia Reform of the Water Sector Program, known as RWS2, and our presentation is on our response to COVID-19 in the WASH sector. So firstly, I'd like to introduce you to our program. It's an 11 million euro volume program that runs from 2019 September to December 2022, and our locations are Luapula province in the north, shown there by the circle, as well as Lusaka with the red dot in the center of the country. Our political partners are the Ministry of Water Development, Sanitation and Environmental Protection, as well as the Ministry of Higher Education. And the key partners are the Regulator for Water Supply and Sanitation, known as NWASCO, the National Water Supply and Sanitation Council, as well as the Technical Education, Vocation and Entrepreneurship Training Authority, TEVETA, Luapula Water and Sanitation Company as one of the utilities, while Lusaka Water Supply and Sewerage Company is the other utility. We move on to the next slide. And just to mention that our water utilities changed their names from previously being water companies to now water supply and sanitation companies. Okay, so our main areas of focus as RWS2 are firstly accountability and transparency in the Ministry of Water Development, Sanitation and Environmental Protection, where we are strengthening the core processes of the ministry in order to achieve increased efficiency and transparency. Next area is water supply and sanitation in rural growth centers in Luapula province. So Luapula province is actually the poorest province in Zambia, and most of it is typically rural. The third area of focus is technical education, vocational and entrepreneurship training in the water sector, where our program is supporting the improvement and enhancement of capacities within water sector specialists and experts. And our fourth area of focus is sanitation services and industrial wastewater in Lusaka. We move on to the next slide. Okay, so what has been our COVID response as RWS2? So Lusaka Water Supply and Sanitation Company is actually the first implementing partner that we have been supporting from April 2020 with a volume of 94,000 euro. And this support focuses on three main areas. Firstly, strengthening the readiness of the utility staff for COVID-19 response. And this includes areas of training in emergency response, as well as ensuring that the staff have the necessary protective clothing. and also improved hygiene practices at the place of work. Then the second area of focus is awareness raising and outreach on preventing the spread of COVID-19. So a lot of community activities that all aim at enhancing knowledge levels as well as improving behavioral change. Then ensuring continued access to safe drinking water and sanitation in peri-urban areas, where we're supporting the utility to ensure that they do continue with their normal business in spite of the effects that they are facing right now and the challenges. The achievements of this response include training of water kiosk operators on COVID-19 related hygiene measures and social distancing at the water kiosks. I should mention that the water kiosk is a centralized water point in peri-urban areas, and actually a peri-urban area is an initially illegal settlement which has since been legalized by the local authority, and hence the need for basic social services just such as water and sanitation. So the water kiosk actually provides for a maximum of a radius of 1,500 people. So with this support, we are ensuring that social distancing is upheld and the hygiene measures at those centers are also enhanced. A second achievement is the provision of material for water quality testing. Usually the CUs have challenges with acquiring such testing kits, but with our support, this will be a reality. Then installation and regular filling of 7 water tanks in the same peri-urban areas which otherwise have no regular water supply for various reasons. And then training of approximately 200 staff members of COVID-19 related rules of conduct and provision of face masks and protective clothing. We have also provided IT equipment to management staff for home office. So this is meant to enhance their virtual operations as generally, especially in our countries, we work from the offices, and it's now that we are really going into the digital age and working remotely. Then the last achievement is COVID-19 related outreach and awareness campaigns. This is through flyers, radio, TV, and roadshows. It should be taken into account that according to the information from the utility, around 1,400 cubic meters, which is equivalent to 1.4 million liters of drinking water, have now been additionally provided since April until mid-June, and from which more than 20,000 residents in Lusaka are actually benefiting, the majority of these being the poor. We move on to the next slide. Next slide, please. Okay, so recently we have embarked on support to other partners, and with Lusaka Water and Sanitation, Lusaka Water Supply and Sanitation Company, we have another financing agreement which is just beginning, and this one focuses on business continuity plan for the utility. It focuses on pandemic and crisis planning, ensuring that the utility can withstand future potential crisis and also survive the times. We are doing actually a similar thing for the other utility, which is also Luapula Water. And then we are also focusing on water supply improvement project in Chunga and awareness raising. And this amounts to €100,000 through a financing agreement, which starts this month and ends in November 2020. And the expected result of this financing agreement is that there will be an improvement in access to water in 414 households, which is approximately 2,400 people, including a school with approximately 300 pupils and a church. Then for the local authority in Lusaka, which is known as the Lusaka City Council, we're implementing measures that aim at strengthening the local authority's public health department. This is worth €45,000 and also running from August to November 2020. The measures that are being implemented include health and hygiene promotion in schools, communities, sustainable solid waste management, training of field workers for best practices to limit the risk of infection, and awareness raising. As you might imagine, there's a lot of interaction between these public health workers and the communities. So we are ensuring that they themselves are protected, and also we do not spread the virus to the beneficiaries or the community members. Then we are also collaborating with the Lusaka District WASH Public Health Committee, which is a WASH and public health stakeholder coordination mechanism set up with the support of RWS2, and with the LD, what we call the LD WASH PHC. We are actually publishing a lot of IEC information, education and communication materials. We're also going to undertake a community assessment. As we heard from Robert, the targeting, the messaging should all be adaptive to the needs of the communities and the beneficiaries. So before we can do all this, we begin with an assessment, and the results from that will actually guide and shape the IEC campaign. Then the expected result is an effective coordination of the COVID response measures within Lusaka, and this is through the awareness campaign and the mobilization of community groups. So in the response, we are actually ensuring the engagement of the local leaders, the local implementers, to ensure that the capacities are built and even sustained beyond our COVID response support. We can move to the next slide. Then for Luapula Water Supply and Sanitation Company in the north, which is one of the very small water utilities that we have, we're improving their operational crisis preparedness in the rural district of Mwense, and this is currently characterized by erratic water supply. The local subsidy amounts to €47,000 and is running from August to November 2020. And the support includes the protection of frontline staff, the field workers, the cash pay points, development of business continuity plans, and equitable service delivery and awareness raising activities. For the Ministry of Higher Education and Technical Education, Vocation and Entrepreneurship Training Authority, that's the ministry and the regulator that is responsible, we are implementing measures with the two and strengthening the digital approaches in vocational training in the water sector, as well as developing a fast-track certification program. The expected result for this is reduction in the negative effects of the pandemic on vocational schools and skilled workers by establishing digital forms of learning and certification. For our main ministry responsible for water supply, sanitation and environmental management, we are raising awareness on the ministry's resolve and coordinated approach towards improved health of the Zambian people through provision of portable water and sanitation facilities. So we are increasing public awareness by supporting the ministry's interventions and those of the utilities by they are implementing on basic hygiene practices such as hand washing with soap. And as a result, the ministerial directive to prevent the spread of the pandemic will be realized. Next slide, please.
Nora,
yes.
You have 1 minute left. If possible, speed up a little bit. Thank you.
Okay.
The presentation is finished anyways, Nora.
Okay, so thank you very much. That is the response from RWS2. Done.
Thank you so much, Nora, for outlining all this huge amount of activities actually you have been doing in Zambia as COVID response measures. Now moving on to our last but not least presenter, who is Jumana Al-Ayed from Jordan. Jumana, please, if you wish, the next 2 slides are for you. Thank you.
Yeah. Good day, everybody, and warm regards from Jordan. Actually, in Sanitation for Millions Jordan, we are working with very strong coordination with religious authorities in Jordan. Actually, religious people, I think in the whole world, but I will talk specifically about Jordan, people are these religious actors are very much trusted by people. Actually, the people are mobilized and motivated by religious actors who are significantly contributing to sustainable development. Of course, as everybody in the whole world, faith communities form a huge network, and people can be reached at a wide level through religious actors. In Sanitation for Millions Jordan, we are coordinating with religious actors comprising from Ministry of Islamic Affairs, which is the government institution, the main government institution for Islamic affairs. In addition to another department, we call it Fatwa. Fatwa means the legal advice provider, of course, legal advice from Islamic perspective. And Dar al-Fatwa or Ifta, it's according to the latest survey in Jordan, it is the #1 trusted organization in Jordan by the community. During the pandemic, actually, the COVID-19, we found ourselves, as in the whole world, at a sudden, we are locked down at houses, nobody can get out. Communication is very much, of course, movement is restricted, and the communication is only through the media and the social media tools. So we thought that we want to reach people who are locked down. That was one point. And also we want to talk to them with the language that they understand, appreciate, and can follow and react to. So we found out that we need to talk to people. First of all, we used, as a response to the COVID-19, we used the TV, Dar al-Ifta or al-Fatwa department. They have a weekly program on TV, on the local TV channel in Jordan. This program is very much followed by people, and it's also one of the most followed up programs on the TV for the Dar al-Ifta. So, of course, the Mufti, we call him the Mufti, is the person who provides this advice, legal advice, and as you see, they have this special uniform with the headwear, and they are very much respected as advice providers. So we agreed with them to organize a dialogue TV show talking about Islam perspective for hygiene, wash and hygiene. And the program, it was really not only from my perspective, but from many of people who attended this program and commented on the social media, of course, platforms. The idea of providing information, talking about not only hygiene as a hygiene, it's talking about hygiene as mentioned in the Holy Quran Kareem, the Holy Book of Islam, that the verses in the Holy Quran, one of the main verses, it's indeed Allah, God, loves those who are constantly repentant and loves those who purify themselves. And the discussion or the dialogue between the two muftis during this TV show was talking about how Muslim people, they are competing and they are very anxious to gain Allah's or God's love. And this is one of the main motivation to people to concentrate or focus on being clean and washed. Of course, in Islam, purity is half the faith. It's mentioned in the Holy Quran, and cleanliness is a branch of faith. And because hygiene is the reason for God's love, people are keen to stay clean, especially because this is a condition for the validity of some workshops. The workshops like the prayers, which is 5 prayers a day for the Muslim. So the TV was really very, let's say, not only convincing, it talked to the hearts of people. And it was not only talking about cleanliness from the from the body, they also talked about spiritual cleanness or inner cleanness, how people think cleanly, how people spread love and good values to other people. So this program was one of the response measures that we have to act to reach people. Second slide, please, Alicia. As I mentioned to you, we needed to reach people at their homes and also with the language they understand, and also according to the different target populations. The TV show, it's known that it's mostly watched by elderly people, which is really a very important target group in the epidemic. And also we needed to contact youth. So we had to go to the Facebook and use a Facebook tool for holding a contest on hygiene and its impact on protecting from epidemic diseases. Actually, also we used the IFTA department because of the trust, and actually what we used the Facebook of the IFTA department, and we organized this contest. It consists of 10 serial episodes. The episode is only 1 minute because nobody will spend more than that time listening, as you know. So it's 1 minute, just the Mufti, as you see in the small picture on above right side. This Mufti just delivered in only 1 minute, maybe 2 sentences, talking about Islam's perspective towards hygiene. In each serial episode, there was one issue. For example, one episode was about cleanliness of hands, others was about cleanliness of the public spaces, or cleanliness of the homes, or cleanliness of the body, or whatever. So he started talking about cleanliness in different episodes, and people had to upload the guidebook, the hygiene guidebook, which was produced by Sanitation for Millions Jordan. This guidebook was downloaded on the Facebook page, and people have to download the book because the book contains the information that they need to in order to be able to answer the questions. And accordingly, we had about 10,000 viewers. We have many people who downloaded the guidebook. We had, of course, many people participating. 200 of them were successfully answered the 10 questions correctly. And of course, they were rewarded. An award was provided by Sanitation for Millions Jordan to the IFTA population, people who participated, and the winners, 3 winners, received 3 tablets. The nice thing actually that we liked a lot, it's not biased, please don't catch me for that, but the winners were 3 ladies, and we were so happy to, of course we know, but we were more assured that ladies like to read more, like to participate in such activities. And of course, we couldn't have their pictures because this is restricted in the Islamic religion. We were planning to have pictures with the Grand Mufti, head of the IFTA department, on the Facebook page with honoring the winners and, of course, having photos with them, but we couldn't have this because there were 3 beautiful ladies who won this contest. Actually, as good practices, as we see, it's very important that religious actors were involved. They are always involved with us during the project, but they were more involved, and actually we received really encouraging feedback from the Dar al-Fatwa department because it was the first experience doing this contest. So they were very much appreciated this kind of activity, and they wanted to have more activities. So just to close my presentation, actually, I just want to confirm that religious actors differ from country to another. Of course, this is normal, but in general, the general approach of cooperating with religious actors on WASH issues through prevailing religious value systems in each country remains the same, and it's really a replicable good practice. So this was one good practice, dealing with religious actors, and the second one was approaching them, people, the population, through media channels during this COVID-19 epidemic. Thank you.
Thank you very much, Jumana, for this great input and for explaining us your work with the religious leaders, which is really, really interesting. We have only 5 minutes left, but we have a few questions. So there's one question to Nora and then one to you, Jumana. So the first one to Nora is regarding how do you coordinate with other actors in the sector? And also the question, what is the best way to link COVID-19 response measures with the development approaches as outlined in Zambian sector policies like the ODF national strategy? That is for you, Nora. A really short answer would be nice. And then for you, Jumana, the question about the impact of your measures. But first, Nora, please.
Thanks, and I've actually provided the response in the chat where I was talking of a coordinated sector approach in which GIZ is participating, and by virtue of the fact that these meetings are chaired by the Ministry of Water, who oversee all these frameworks and strategies, we believe every approach is taken into account. So my response is there in the chat in more detail. Thank you.
Okay, thank you, Nora. Jumana, we have one question for you about the impact of your measures. Can you say a few words about that?
Yeah, actually the impact, it's of course the response of people who are really concerned about changing their behaviors for cleanliness, for hygiene and cleanness of their hands, washing hands and bodies. Of course, downloading the hygiene guidebook by 200 people, this means that the impact will be reflected on not less than 1,000 or more than that, because we are talking about families. If the mother downloaded this hygiene book and participated and knew all the details, then we are sure that this will be reflected on the whole family and children. Yeah, that's it.
Okay, thank you very much, Jumana. I think we're coming to an end now of the session. We do have a discussion thread on the Sustainable Sanitation Alliance discussion forum about this webinar. So in case there are any more questions to that topic, you can go to the discussion forum. I just put it in here, the link. Thank you to all who participated. Thank you very much to all our speakers for the excellent inputs. And the next session is waiting. So at 11:30, the next session on WASH and NTDs is starting.